Hi there, my name is Karen Kerr. I am a student at Indiana State University in the nursing department, and this is for my community health class. I have a teaching module. My population at risk is adolescents aged 10 to 19 who have a diagnosis of a mental health disorder. And my title of my presentation is Constipation, what you should know and what you can do. My objectives are at the completion of this module, the learner will identify the correct definition of constipation with 80% accuracy. The learner will identify 2 causative factors of constipation with 80% accuracy. The learner will identify 2 things they can do to avoid constipation with 80% accuracy. And all learners will be provided with a handout of useful information at the end of the module. And so here we go. At this point, I would ask you to stop and take the pretest. And I am going to tab through the pretest quickly. You can pause this video if you're watching on a video so that you're able to answer all the questions. I will provide a handout for questions that you can print as well. And so here we go. What does it mean to be constipated? So everyone has a little bit different version of what is considered normal for them. But typically it's when a person has fewer than 3 stools or bowel movements or poops each week. Stools might be hard. They might be difficult to pass. And then you might have a feeling like not all the stool came out. So what are some causes of constipation? There's a lot of different causes. Some of them we'll talk about could be related to diet, could be related to exercise, medications that you take, behavioral and lifestyle, and then there's like different medical reasons as well. So diet. If there's not enough fiber in your diet, that can lead to constipation. Now there's 2 types of fiber. There's soluble and insoluble. Eating foods that are high in insoluble fiber, or what your grandma might call roughage, helps to prevent constipation. By adding bulk to the stool, it helps it to be easier to pass. And we'll talk about some examples later. Another factor with constipation is not enough exercise. So physical exercise is a necessary thing to help your body to be healthy. It helps you to maintain a healthy weight, and it increases the blood flow to your body's organs. Medications are another factor. Constipation can be a side effect of some medications. And typically medications that are prescribed for anxiety, for depression, for mood, or like behavioral disorders, those tend to cause constipation. And there's also over-the-counter medications like antacids that we take for heartburn, for example, or iron supplements. Your doctor may have prescribed you with iron supplements, which are important to take, but those also can cause constipation. Behavior or lifestyle related factors, mood or behavior patterns can affect whether our constipation. And stress and anxiety can actually increase your chances of having constipation. Behavioral patterns in your lifestyle, like when we skip meals, or if we ignore the urge to have a bowel movement. So say you're out in a public setting, you don't want to use the public bathroom to, when you feel like you need to have a bowel movement. And so you hold it. That can actually cause constipation. So there are also other medical health and nutritional problems that cause constipation. And those are things we're not really going to talk about here. That would be something diagnosed by your doctor, and there would be treatments that would vary for that. Things that you can do. So what can you do to reduce the risk of getting constipation? Eat plenty of food with insoluble fiber. And that those types of foods would be whole grain products, nuts, carrots. grapes, berries, apples or pears, like as long as they have the skins on them, those are insoluble fiber. And you want to plan to eat a serving of a high fiber food with every meal. And then you want to increase the amount of water that you drink. So water, it works with the fiber to add bulk to your stool. It makes it easier to pass. So keeping your body hydrated, it helps to break down and distribute the food and the nutrients to your body. It helps to soften the stool. And all of this works to help stop constipation. And you want to get moderate exercise, an hour every day. And doing that increases the blood flow to your organs and helps maintain the muscles in your body. And the muscles are used to control your bowel movement patterns. And what you can do if you have constipation, here's some things that you can do. So do all the things that we just talked about. And there are over-the-counter medications that you can take. There's a lot of kinds of medications out there. We're not going to talk about all those because you should talk with your doctor about those. If you need a medication, your doctor can help you to find out the right thing for you, what's going to work best for you. You want to ensure that you continue to take your prescription medications. Even if you think they might be a cause of your side effects, you still need to take those, and that's an opportunity for you to talk with your doctor about maybe making some changes or make a plan with your doctor. And if you have constipation that doesn't resolve, if you have rectal bleeding, if you have abdominal pain, seek medical advice. Talk to your doctor about those things. And next slide is some resources for you. So again, if you have severe pain, bleeding that doesn't stop, seek emergency care, call 911. If you have constipation that doesn't get better, you want to contact your doctor. If you don't have a doctor, I do have a list here on the resources. In the state of Oregon, there's some federally approved health centers. Check that document out. And then Portland Parks and Recreation is a great resource for you in the city of Portland. You can get some information on everything from hiking, community classes, sports, things that can keep your body moving and keep your bowels moving too. myplate.gov is a great place to find nutrition and fitness links, and they have pages that are geared specifically for teens. It's awesome. And the USDA nutrition.gov, you can look there to find some resources to help you learn about food labels and building your healthy eating habits. And here's my references. Now go on to the post-test. Let's see what you learned. And again, I'm just going to tab through all of these. You can pause it as you need to. And again, I do have a printable link at the end of this video. So thank you very much, and I'll see you next time.